You just repeat it after me. So, blue sky.
Blue sky.
Good weather.
Good weather.
Sleepy nights.
Sleepy nights.
Okay, I'll do the other one. Sweet dreams.
Sweet dreams.
Ice cream.
Ice cream.
Funnel cake.
Funnel cake.
Similar to the eye, we're going to begin with inspection. Okay, so in my previous video, I did a point of view ear. So would it be okay if you just take your hair out of your ear? So always getting consent. Even though we got it, it's good to get it again. And we're just inspecting the general shape of the ear here. And if we notice any unusual findings, and those are usually redness or lesions. In this case, I don't see that. Gonna also, is it okay if I touch your ear? Okay, I'm going to just pinch the pinna and pull it upwards. Sometimes pain on that can be caused by otitis externa. Pull it downwards. So this individual is wearing an earring, so it's important to note, because sometimes if there's an allergic reaction towards the metals, then we'll see some lesions around that skin area. While we're here, it's also important, so we're just testing the malleability and mobility of the ear, which is made out of cartilage. We're also kind of gently palpating the mastoid process, because mastoiditis could be indicative of an internal ear infection around the tragus area here, around the masseter, the jaw, and the TMJ. Any kind of issues there?
No.
Okay, so I'm going to repeat the same thing on the other ear, and I'm just comparing what I saw from one ear to the other. So just visualizing that beautiful ear, and also going to start the palpation process. So just going to pull up and press around, down, press on the tragus. Also the mastoid process. Is that here? Can you just open and close your jaw? Any discomfort there?
No.
Perfect. So that is the inspection of the ear. In both cases, I didn't see anything that would be too concerning. Okay. From there, we can now examine the ear. Oh, before we go in with the otoscope, we should do a hearing test just to see if your hearing is intact. Okay. So the first hearing test I'm going to do is called a whisper test. Essentially, I'm going to whisper 2-syllable words into one ear while we distract the other ear by pressing on what is called the tragus, this little skin prominence on one ear. So just pressing that to occlude the hearing ability of that ear. And I'm going to whisper certain words here, and if you could just repeat it after me. So, blue sky.
Blue sky.
Good weather.
Good weather.
Sleepy nights.
Sleepy nights.
Okay, I'll do the other one. Sweet dreams.
Sweet dreams.
Ice cream.
Ice cream.
Funnel cake.
Funnel cake.
Okay. It sounds like you were able to discern those words. So that shows to me that your hearing is intact in both ears. Although for some people the hearing is not equal, and they may be able to notice that. Have you ever noticed a disequilibrium between the two ears? Okay, so in your case, you're hearing equally on both ears. Okay, so sometimes we'll see diminished in one ear or diminished in both ears, and the next exam will help us determine what exactly is happening. Okay, so we have here tuning fork. This is the standard tuning fork we use for the hearing test, 512C. Okay, so the first test is called the Weber test, and what I'm going to do is I'm going to strike the tuning fork so you can hear this sound. Okay, and we're going to place this tuning fork onto either your forehead over here or on top of the head. Okay, so once we do that, theoretically, the sound will lateralize onto the bone. So we are testing to see whether your sensory neural capacity is able to detect that through the bone conduction, but also through air conduction. So if there's one lateralization to one ear or the other, that would usually indicate that there could be a problem with the sensory neural bone conduction or air conduction, depending on where it lateralizes to. So let's just strike this tuning fork one more time. Here we go. So I'm going to place this on your head.
I can't really hear it.
Yeah, so this tuning fork, it's not with you, it's with this fork because it's kind of a defective one.
Okay.
So you can blame the University of Toronto for that.
Mine is from University of Toronto too.
Okay, so, yeah, I don't know what their medical students are using, but so I'm going to use the 128C and C. It's give you a test of what it sounds like. It's a lot more potent. Okay, so we're going to try that exam again.
Yeah, it's equal.
Okay, so it's equal and bilateral on both sides. All right, so next is called the Riney test. So if we suspected any inequalities of where you can hear, this is a good way to test whether it's coming from bone or air. So if it's a nerve, like a sensory neural hearing loss, or it could be that there is a foreign object stuck there, occluding the air conduction. So I'm going to strike the tuning fork again, place it into the mastoid process, which we felt earlier. And once you stop hearing the sound, I'm going to place it to your ear, and you let me know when you hear it, when you stop hearing it. What we normally would like to see is that the air conduction is greater than bone conduction. So that means that after you stopped hearing it into the bone, you should still be able to hear it into the air. Okay, so we're going to do that right now. So I'm going to start here and place this into the mastoid. So you hear it. So let me know when you stop hearing it.
Okay.
All right.
I can still hear it.
Okay, good. So normal finding is usually 2 to 1. So eventually you'll stop hearing this, and that'll indicate that air conduction is greater than bone conduction. So like you said earlier, we should test both ears. So I'm going to repeat that same exam onto the other ear. So right over there.
I can hear that.
So let me know when you stop hearing it.
Okay. I can still hear.
It is 2 to 1, right? So you'll hear it twice as long. So that's what we would like to see. So air conduction, bone conduction. If there's any moment when that's deviated, then that could really tell us where the hearing loss is occurring. Okay. The other thing to assess with ears are your gait and balance, because vestibulocochlear nerve, cranial nerve number 9, I believe, is responsible for detecting your spatial acuity. Have you had issues with dizziness or vertigo?
No.
Okay, good. So how's your balance? I mean, in a general sense, some people have. Okay, all right. So you're not tripping over. And sometimes, I've had patients where they would show up to me with bruises, and so I'd assume that they've fallen or they've hit themselves. So one of the things that I ask for is if they've been drinking, because it's one of the indication. When we drink, it really occludes our cerebellar function to detect our spatial awareness. So it's cerebellar ataxia, and it can cause us to fall. There's many reasons why we fall. Sometimes it's loss of balance. Sometimes we slip on things, or we just lose the mobility and range of motion of our limbs. But it's important to assess that when we're doing a hearing exam, because a person can knock their head onto something and go unconscious. So, yeah. So, do you have any questions about that?
No.
Okay, so I think we're good to go with the otoscope investigation into the ear canal. Okay, good. All right, Angelica, so we just finished the eyes and also the ear examination of the external ear, at least for that matter. Now I'm going to have a look into the ear canal to see the tympanic membrane and or the eardrum, what it's called, to see the health of it. And I'm going to be describing what I'm doing as we go along and what I'm seeing. Is that okay with you? Okay, good. So I'm just going to now switch up the otoscope to the ophthalmoscope. Alright. So we have these disposable ear probes to allow us to be sanitary. Alright, so just try to open the probe so we have a light. Alright, so we're going to start with your left ear, and I'm going to hold the otoscope in such a way, and I'm going to place one hand into your head just to kind of stabilize it. Okay, if that's okay with you, we can go ahead. If you can just look towards that direction just to make it a little bit easier for me to visualize it. So I'm just again stabilizing the head of the patient. We want to pull the pinna upwards to kind of straighten the canal. Unless they're young children, then we pull it downwards. And then from there, okay, good. So here we have a ear canal, and we are seeing some cerumen, which is normal in this case, an eardrum that is pearly white. Have you had I see that your eardrum has been punctured. Is that
Really?
correct? I mean, I don't know if I'm saying it correctly.
I don't think I have.
Or, okay, it's actually just the shadow from the handle of the malleus.
Oh,
Excuse
okay.
me, sorry. It's so dark that it looks like there's a hollow there. So I'm looking at the umbo. Sorry, this is clouding up a bit because of moisture. But I did see the cone of light at 5 o'clock. On the upper 11 o'clock, it looks like a hollow tube, but it's just the shadow coming from the tympanic membrane. So nonetheless, it's pearly gray, and it's good to kind of verify with the patient whether or not what we're finding is actually true, because some people do have ear tubes where there is a hole there. So sometimes we find that, usually not in that location. We often see it in the pars tensa, closer to the bottom. So just wanted to verify with you. So I'm gonna also do the other. I wish I can show you your own ear so you can see, but it was an interesting finding. So again, I'm gonna stabilize the ear, pulling the pin upwards, and I like to hold my otoscope in an upside down manner because I feel like it gives me better control. Okay, here we can really see the vessels, the blood vessels. So there's some redness in those ear canals. Sometimes this can happen if the patient has just recently cleaned their ears, so it's good to ask that. Otherwise, the eardrum or the tympanic membrane is pearly white. It's very visible here, and the landmarks are quite visible as well. So we got the handle of the malleus, the umbo, and the cone of light here, which we're finding closer to the 4 or 5 o'clock. Perfect. So that one is nice and healthy and clear. Yeah. So I didn't notice anything obstructing the ears which can cause hearing loss or any lesions, other than a little bit more redness on the right ear. Is that consistent with your experience?
I've been wearing earbuds,
Okay.
like to listen to music. Maybe, I don't know.
Okay. Sometimes, yeah, when we wear over time, they can just the kind of friction of can create some redness, but otherwise it's not sore or painful in any way, is it?
No.
Okay, good. And also like to ask patients about their hygiene practices, because sometimes it can cause problems. So if they're using Q-tips, they can potentially push cerumen in, or foreign bodies in, causing an obstruction into the canal. So it's just important to ask about that, educate the patients about how to perform proper hygiene of their ears, which in this case we usually recommend not to do any. And if they do feel like there's something there, to see a doctor who can take a look at it, to make sure to see what it is and perform the proper procedures of extracting whatever it is. Okay, so in our clinic, in our school, we actually have a really cool ear lavage, which is this hose that goes into your ear, and then it just kind of like cycles and takes out. Yeah, I've never had a chance to try it. Have you?
Me neither, no.
Yeah, I had my clinic during COVID, so we were all online, and I missed out on that.
Yeah, me too.
Okay, so the joys. So I think that then concludes our ear examination. There was nothing unusual or anything concerning. Now we can move on to the nose and throat area. So just general inspection of the nose here. I'm looking at the structure of the nose. Sometimes we'll see the nose deviated to one side or the other if they've experienced injury into that broken nose in the past. Any kind of lesions or such as moles or anything that would cause us to be concerned, but in this case I don't. If you look upwards towards the ceiling there, so I can just see the opening of the nose to see that it's patent. I don't see any mucus, and if I do, I'd be describing what the texture, color, consistency is. We can go with the Otoscope. I'll probably need to switch this to a new one. So we put that into the ear. So one of these. Okay, there we go. So I'm just going to place it there. And alright, so I'm just going to place my hand onto your forehead, and I'm going to, if you can look up towards the ceiling here, and I'm just going to pull the nose upwards a bit so I can visualize. So the nares, which are the small fine hairs, and I'm going to start with this one. Alright, so immediately I can see some redness. Sorry, the breath is making it difficult for me to, because it creates
hold my breath. I think I should hold my breath.
Yeah, I think that's one of the things that I'm supposed to instruct you, is to hold your breath. Yeah, because otherwise it's creating a fog. Okay, so if you take a deep breath in, and then just hold your breath. Oh, sorry, and exhale and hold your breath. Okay, there we go. Alright, yeah, so I do see some redness. More than what I would usually find to be. This one is a little better. Still, we have some redness, and it seems a little bit dry. Is it? You have had dryness in your mucosa? Any irritation? No? Okay.
Maybe from the air.
It could be, because we've had a fire rage here in Canada, so sometimes irritants can cause that. But yeah, it is quite more red on the left side, and the color is almost like lipstick red. More red than your lips, so it's yeah, you can even go to a mirror when you get home and take a look. Sometimes that can happen when people pick at their nose, and it can irritate them. So it's just important to ask, you know, what do you think happened? But you're right, there has been a lot of air pollutants in the air within the last few days. And even myself, I felt the irritation into my eyes, the burning and stinging, because of the smoke pollution. So it's important to note. So what you can do is you can apply Vaseline or petroleum jelly just to kind of moisturize that area, or coconut oil if you want to use something more natural. But that's just something, if it's not bothering you, yeah.
Okay.
So that's the nose area. I think, yeah, so we're looking at the pansy, the shape, the mucosa, and the alignment of the nose, and I think that's what we're looking for. Olfactory nerve as well is something that we can test. We have that little spray. Oh, here it is. And what you can do is you can just close your eyes and you can try to, oopsie, sorry. And you can just kind of waft it towards the nose and let me know if you smell something and what do you think it is.
It smells very nice.
It smells floral.
Very relaxing.
I'm happy to hear that. Unfortunately, the ingredients have been blurred out, so I can't tell you what it is. But so yeah, so that's one way we can test the olfactory. Of course, it's important to ask them if they have any allergies before spraying anything, because you don't want to spray something that can cause allergies, such as artificial perfumes and such. So this is made out of natural essential oils. Okay, so that's taking care of the nose, EENT. The last thing would be the mouth and throat.
The other thing was patency, like to breathe in through
Yes.
each nostril just to see if they can breathe.
Okay, so for this one, I'd probably ask them to
Yeah.
plug their,
Yeah.
because it's kind of weird to have someone poking
Do
to your
it for
nose.
you.
Yeah, so yeah, if you could just,
Yeah.
I'll demonstrate on myself. You could plug one nostril. You can just see if you breathe in there and out. And the other one.
Yeah, I think the left one's a little bit more stuffy than the other one.
Which is nothing unusual. If it was fully stuffed, then that's when we'll do an investigation of the sinuses, which we should do.
Yeah.
In this case, we'll just press gently on the frontal sinus over here. We got also the ethmoid and the sphenoid and the maxillary sinuses. So for someone like me who has seasonal allergies, you know, I get sinus congestion, so I can't even do the patency test right now because I already have congestion. It's very difficult to pass air through, so which could cause issues when we're mouth breathing because we're not properly filtering the air. It also causes a lot of dryness in the throat, and so we always want to be breathing through our nose. Ideally, that's the healthy way to breathe. We have those hairs which filter out those pollutants, so if you're someone like me, you're mouth breathing the smoke, then that goes straight to the lungs. So we don't want that. Okay, so next, thank you for correcting that omission. So now, since I palpated your face area, is it okay if I go ahead and palpate for the lymph nodes as well, which is part of the throat area?
Yeah, go ahead.
So over here, we're going to start with the pre-auricular nodes, just in front of the ears. The post-auricular. Okay, there's also occipital lymph nodes. So what we're looking for are small, round, nodule-like structures that are freely movable. That's what's the jugular, submandibular, submental. Okay, sometimes you could feel them. On Angelica, it's not palpable. You feel it more if someone is having an infection. So deep cervical. And over here. Like you shrug your shoulders. Sometimes we can get a better palpation there. And we're also, when you do that, we're also testing cranial nerve 11, which is accessory nerve. So we did multiple things. Check for nerves, infection, and the lymph nodes. Okay, so nothing unusual there. I was actually unable to palpate any. Some people like myself, you could always, especially with my allergic attacks, so the lymph nodes are activated. So now looking into the lips, because Angelica's wearing lip gloss, ideally we're looking for the color. So if someone is having a difficult time breathing and oxygenating and perforating their tissues, then we'd see what is called cyanosis, or blue tinge into the lips, which in this case we don't see. because there's lip gloss.
Mm-hmm.
So from here, just looking at the shape, sometimes we'll see for dryness, some cracking at the edge. The surrounding features, as people who shave sometimes will get cuts. I've seen also sometimes warts in this area. So if someone has been exposed to HPV virus, it's just a good kind of indicator when we inspect into the throat to see if there's any abnormal growth for any kind of throat cancers. So that's okay. So if you could give me a smile, we're just looking for the symmetry here, the facial nerve. Okay, good. So asymmetry would indicate either damage to some of the facial nerves, or even in stroke where we have paralysis, cerebral palsy, one-sided paralysis. So in this case, that's not present. So if you're able to, now, okay, I'm gonna bring back the light here. So usually the exam is done with a tongue depressor, but I always try to avoid placing any intrusive objects if not necessary. So in this case, we're just gonna open their mouth and say, if you could look up towards the ceiling one more time. Okay, good. So I'm just gonna shine a light. I'm looking at the uvula, which is the thing that hangs down, is in the center. You could stick your tongue out. Perfect. I'm looking at the tonsil, the hard and soft palate, the teeth as well. While I'm at it, the tongue. If you could raise the tongue to the tip of the mouth and the veins at the bottom of the tongue there, and sometimes we can see the perforation and blood circulation. In this case, you can close your mouth. I didn't see any lesions. I didn't see any sores or any of those things that would be concerning. Okay. The tonsils are also not enlarged, indicating that you don't have an infection. So the last portion of this exam, which would ideally be done with me behind you, so I could place my hand into your throat area to palpate for the thyroid. But in this case, it still could be done from the front, what I usually do. So we're going to be inspecting the thyroid. We can shine a light just to see. There's the palpations that we would normally see in either the carotid artery or sometimes the jugular vein when we're laying down. So I'm just shining here at the SCM area, and I don't see any thyroid nodules or goiters or anything that would concern us. No lesions. Sometimes could you swallow for us? So that's the vagus nerve 10. Any difficulty with swallowing at all? Nothing. Okay, so from now then, we did the inspection. I can now just palpate if that's okay with you. So just gently, we want to palpate one side at a time so as not to occlude the carotid artery. Okay, the trachea is midline, and then we can feel some boggy structure. In Angelica's case, it's not easy to palpate, so what we can do is push against on one side to kind of push the thyroid. There we go, more towards the hands, and I'm feeling for any kind of bumps or nodules that would be unusual in this case, or any enlargement. While I'm here, I can palpate the pulse, which is strong and bounding on the left side, and I'm going to do the same thing, push it to that side, and we can palpate the thyroid. Now, the accuracy of this test is not very high when it comes to sensitivity, but it's good to start with. So if we notice any other symptoms, like earlier, the patient has said that, they're experiencing fatigue, weight gain or weight loss, restlessness, increased thirst, thinning of the hair, then that could lead us to suspect that the thyroid may be involved. Then that's when we'll do further investigations. Usually we'll order a TSH, a T3, a T4, and I think there's one more.
You said TSH,
T3, T4.
You could do antibodies.
Yes. The
anti-TPO, anti-TG, thyroglobulin.
So much, which you know more than I do, so thank you so much. Yeah. And based on that, we can determine what is the cause of the thyroid dysfunction and how we can correct it. Okay, so I think that concludes the neck portion of the exam. I looked at the skin. There's no visible lesions. So today we did the eyes, ears, nose, throat exam. And just the general appearance of Angelica's beautiful face here, very angelic, as you can see the light just shining down. So thank you so much for not
you're
only...
welcome. Thanks for having me.
Thank you. Thank you. You've helped me so much, and so my exam is in about a month, right? I'll be writing, and hopefully it's a pass, so we can get going.
I know we will. I know it.
Thank you so much, and congratulations on passing your exams.
Thank you.
The next time we see Angelica, she'll be a full-fledged doctor, and you can go see her wherever she's practicing. So thank you so much for your help today.
You're most welcome.
Thank you for tuning in. Don't forget to smash that like, comment, and subscribe, because that helps the channel grow a lot. Thank you so much, everyone, and I'll see you again in the next video. Ciao.
Did you sleep well? Your cat is very chill. And you have beautiful green eyes.